So, Gloria, I don't see any participants on my screen, but do you just mind letting me know when there's a good number in so we can start?
46 people have joined so far, but they're still pouring in.
Okay, great. Thank you. Good morning, everybody. Afternoon, evening. We're just letting a few more folk in, so please give us a minute or so. Hi, Dr. Hudson. I see you're back on screen. Is all good?
Still struggling with the settings. I don't know what happened.
Not to worry. That's okay. So let's see how we go, and you can stay off camera. Yeah, that's okay. Okay, let's get kicked off. I think we have enough in the room, right, Larissa? We're good to go?
64 so far, but people are still joining. I
Okay,
think you can go ahead and start.
okay, perfect stuff. All right, good morning, everybody. Good afternoon and good evening to those joining in the later part of your afternoon. Thank you for joining us today on the webinar on the topic of AI in HIV, and specifically the topic around centering communities in the age of algorithms. So that's a mouthful. I am Charlene. I'm the Strategy and Organizational Effectiveness Lead here at ITPC Global, and today I'm taking the pleasure of hosting you and moderating this webinar. So, are the robots taking over? A couple of decades ago, when people talked about robots taking over the world, we laughed, right? It sounded like something out of a movie. Some of us thought, I mean, surely this won't happen in our lifetime. Well, here we are. And if you've used ChatGPT this week, or if you have a robot vacuum cleaning your floors at home, you might agree that robots are living in your house with you and bringing the power of artificial intelligence, or known to us as AI. The reality that AI is no longer science fiction, and more importantly, it is already shaping the HIV response. It's shaping how we analyze data, design programs, and make decisions across the sector. So today I'm excited to guide a conversation that goes beyond the innovation, because while algorithms are powerful, the HIV response has always been driven by people. And communities in particular hold a unique and critical position in shaping how these technologies are used and ensuring that they reflect lived realities, protect rights, and truly serve those most affected. So, in the next 90 minutes, we will unpack the concept and the application of AI in HIV with a specific focus on centering communities around the response. And we'll explore key themes such as who controls the algorithms, whether communities are just data sources or real decision makers, how to harness innovation without deepening inequality, and what meaningful community governance of AI looks like. We set out to be very ambitious today, but we do only have 90 minutes, and the time will be spent across three areas of flow. Some key framing in the beginning for 10 minutes or so, followed by a rich panel discussion for about an hour from our distinguished panel members who I'll be introducing very shortly. And we'll also have intervals for questions from the audience, and then as well as two planned interventions from the floor. Just some logistics for you. We have 90 minutes to indulge in this conversation. We will be recording the session. I think it's already being recorded. And the audience has the option to use the chat box and the Q&A section to partake in the webinar. So please introduce yourself in the chat box and bring any of your questions to the panel by using the Q&A located at the bottom right-hand side of your screen. This webinar will be conducted in English, and there is unfortunately no translation available. And of course, we have a final comment before we kick off. We really want this conversation to go beyond the webinar. There are two other exciting opportunities coming up on our radar that we're busy working on. The first one is AI 101 training for community leaders. So ITPC Global is hosting AI training for community leaders in collaboration with Odere, a health tech innovation company. And this training will cover the basics of AI and how it relates to HIV. More details to follow on the timelines, but it should be released in the next upcoming month or so, a few weeks. And then secondly, the ITPC Global is working on disseminating a global community AI survey, which is intended to provide insights into the hopes, the concerns, experiences from the community of using AI in HIV and health across the globe. And the results and insights are due to be published in advance of AIDS 2026. So please do watch the space and complete the survey. Okay, without further ado, let me welcome our 6 distinguished panel members who will be sharing their unique perspectives today on this very timely topic. Solange Baptiste. Solange is the Executive Director of ITPC Global, and for purposes of this webinar, she is a commissioner on the Lancet Global Health Commission on AI in HIV, where she is leading a chapter on community-led approaches to AI in HIV. Tatienne Goy is a laboratory technician at the Center for HIV/AIDS Prevention Studies, known as CHAPS, in South Africa, where she evaluates AI chatbot interactions related to HIV. And her work focuses predominantly on identifying stigma, bias, and safety risks in AI communication. Dr. Hudson Balidawa is joining us as a government representative today. He is a public health physician and the monitoring and evaluation expert at the AIDS Control Program, housed within the Ministry of Health in Uganda. Hawinate Bekele is an AI product manager with experience building and scaling technology products. She specializes in applying AI for impact and digital product innovation, with her work spanning across multiple sectors and focuses on the practical implementation of AI to solve real-world problems. Rohit Malpani is an independent consultant. He works on ethics and governance of artificial intelligence for health, antibiotic resistance, and access to medicines. And Rohit was formerly the director of policy for the MSF Access Campaign, a special advisor for Oxfam, and an intellectual property lawyer for the firm of Wilson Sonsini in California. He's also publishing his first book this month with Tahir Amin, which is titled Pharma Monopoly: The Battle for the Future of Medicines. Nomonde Ngema is an HIV activist and a powerful voice for young people living with and affected by HIV, and focuses on health and rights, youth-centered approaches to care, as well as sexual and reproductive health rights. She's a youth advocate in several forums, including Her Voice Fund, Pediatric Adolescent Treatment for Care for Africa, and UNFPA. And of course, for those of you who have joined us, welcome. I'm Charlene Omrao. I'll be moderating this discussion today. I look forward to having the panel on screen very shortly. And in that sense, let's get kicked off. Great. So to get started, let's check in together. Right now, there should be a poll popping up on your screen with 3 questions. In 30 seconds or less, please answer these questions and submit your response. The questions are, number 1, are you using AI in your daily life or work? Number 2, if you had to pick, which would you consent to right now? No questions asked. A swab of your saliva or your browser history? And then the third one is, have you ever used Google Maps or Waze to find the fastest route to your destination? Okay, so the responses are streaming in. I'm going to give it about 20 seconds or so. Okay, we got about 62 respondents. And really, what an exciting participant list. I mean, 101 participants. That's amazing. Okay, I'll give it about 15 more seconds. Okay, good. I think we can end the poll, Gloria. There we go. Great. And Gloria, does everybody get to see these results? Just checking.
Yes, they can.
Okay, perfect. So this is interesting, right? If you have a look at the answers here, are you using AI in your daily life or work? I mean, 90% says yes, 10% no. This next one is quite a funny, controversial one. It's a kind of like a 50-50 or 49-51. If you had to pick, which would you consent to right now? No questions asked. 49% said a swab of your saliva, and 51 your browser history. That is very interesting. I'm sure that some of the panel members today would love to comment on that one. So please keep this in mind when you're sharing your responses. And then, have you ever used Google Maps or Waze? I mean, that's 99% saying yes, we do. And this is super exciting. Thank you so much, Gloria. You can drop that from the screen so that we can move back into the presentation. And really, that is, I mean, it goes to show that AI is built, or artificial intelligence is built into our daily lives in the norm. And that brings me to framing the context of the discussion today in the next 5 minutes or so, is really to start off by taking a step back and looking at where we've come from. This picture that you see on your screen illustrates the Industrial Revolution. Now, an Industrial Revolution is a major period in where science and technology innovations really transforms the way people do things. And it shifts societies from what we knew then as manual craft to now mechanized, scalable solutions. And it reshapes work, cities, and life. And it all started with urbanization. So if you look at the far left of your screen with mechanization in your first industrial revolution in around the 1800s. Now, here it was the birth of what we call urbanization. There was water and steam power that was discovered, and from that came mechanical production, mass production, the rise of factories, and this was what this era or this revolution was known for. And then we moved into the second industrial revolution towards the late 19th century, entering into the 20th century, where electricity was discovered. And with that, it just became a scale up of factories and a scale of what efficiency looks like. So you would have seen a lot of assembly lines being built to scale. There was a lot of standardization, and industrial efficiency was the key success factor for this era. Now, where it gets interesting for us is the third revolution. Now, if you look at the third revolution where it says automation, this was the birth of the computer. So the big box computer thing that we knew in the just before 2000 to now what we know as the laptop. This is how we started moving into computing automation and the rise of electronics that really facilitated data processing. And it was the birth of the digital systems. It's also the era in which we experienced the first information revolution. So, how we receive information and how we disseminate information, and how really we package that information that was shared within or revolutionized in this era. And then the fourth revolution, early 21st century, we started to see the scale of automation with built-in intelligent technologies. And this was where AI was kind of formed and discovered and brought into the market. And it also led to a lot of networks, what we call cyber physical systems, whereas in the previous revolutions, we saw physical infrastructure leading the path for that evolution. This digitization revolution focused on cyber physical systems that did not require finances to build big infrastructure. And we could focus on connectivity, real-time data, and autonomous systems. And now in today's era, we're moving into what many call the fifth industrial revolution. And it's a very interesting way of how this is being framed because it's headed by the word connection. It talks about people-centric technology, human-robot collaboration, and hyper-customization. So this era really emphasizes connection. It talks about co-creation and ethical stewardship. So not just tech for the sake of tech, but for solving the problems and the challenges that matter. And why does this matter here and now? Because really we are at that turning point. So if you look at where we are, this is where the arrow is showing us. We're returning into the fifth industrial revolution. And how we lead and shape the next era will determine how successful we are in meeting the moment for the HIV response. And the reality is, we urgently need to get this done. What is not obvious in this picture is how the rate of science and innovation is becoming faster and faster. And while you don't see it in this picture, the revolution cycles are becoming smaller and smaller. So we are no longer depending on the physical infrastructure. We are working with data systems, and that means we have to move quickly. And it does require us to be sharp and quick to ensure that the fifth industrial revolution is set up for success. This is my last slide, just to take you through how does this relate to HIV? Because this is an important one. It's really where we are in the crux of the matter, and we find ourselves as experts in many fields having these conversations. The HIV response has seen many cycles, and throughout its lifespan, it's been influenced by some of these revolutions, right? But more so, we've experienced firsthand what it means to be good at a good place in the response, and overnight to be threatened by financial constraints and geopolitical power struggles. So today we find ourselves in the 2026 to 2031 Global AIDS Strategy towards ending AIDS. And this excerpt has been taken from the strategic plan, which is tabled to be adopted by the UN AIDS Program Coordinating Board in June this year. And in this strategy, the new landscape calls for three concrete priorities. We somehow need to sustain the response. There must be emphasis on people-focused services, and community leadership is at the forefront in that there must be empowered communities leading the HIV response. These are our enablers for change. And if you look closely at each of the result areas under the priorities, you'll see that the use of AI as a tool is sprinkled across all of these areas, either directly or indirectly. And this is showing us that stakeholders involved in the design, deployment, evaluation, and decision making coming from AI-driven interventions are going to become more and more prominent. So AI is already woven into the strategy as an enabling tool, but its value depends on who designs, who governs, and who evaluates it. And since community leadership is an essential priority in this new landscape, should communities lead and govern AI practice? So that's a mouthful. And we're not going to solve all the answers today, but I do want to move now into the first question for my panel and switch my screen to our panel members. Solange, Tatien, Dr. Hudson, Rohit, Nomonde, Hawinate, welcome. Thank you very much for being part of this rich discussion. I'm going to kick off with a basic question. I've set it up on screen, but I'm going to drop my slide now. The question is, what do you see as the single greatest benefit and the single greatest risk that AI poses for the health response? So allow me to pop this off. Great. Just checking, Gloria, I'm back on screen, right? No sharing. Okay, good.
Yes.
Great, thank you. I'm going to kick off with you, Howie Nate, because you're coming in from an AI tech developer sort of landscape, and you obviously believe in the tool, right? Because you design and you advocate for it. What would you say are the benefit, or the single benefit and the single risk that we have to be mindful of as we navigate this?
Thank you, Charlene. Thank you, everyone, for joining. So that is a great question. AI kind of gives us an opportunity to explore and utilize, if we utilize properly, so many possibilities and use cases. And in this case, I think the greatest benefit it could provide for HIV response is the ability to help us understand and act on complex health data. HIV is not like the easiest use case to start with, as it has like large sets of volumes of data from testing, prevention, or even programs in relation to treatment. So there are data that are generally being, generated on the daily basis that humans cannot easily identify. So I think with AI, we can easily prioritize and identify use cases that we might not easily identify. And we can also identify the gaps in the services, or maybe predict a more broader understanding of what leads to people being at risk in this case, such as like social determinants. So the larger scope of like their existence, right? But at the same time, there is a risk that AI could unintentionally unlock as well, which is, can broaden the existing inequalities that already are there in terms of like the models that are the AIs are built on that don't necessarily, include the general landscape or people that are in the marginalized sense of the community. So if the data or the models that are being built are not inclusive of these individuals, then we have a risk of creating a bigger gap than it already exists. So finding the balance in between, how to utilize this powerful tool without excluding a significant portion of the population is a key thing for me. So, and in the tools that we built as well, we're trying to at least be considerate of these gaps and considerations, and try to find ways to do so, which we will discuss later on.
Right, perfect. And sorry, I have a crazy question, but what is a used case? Just so that everybody understands the language.
That is so true. I was told that I should not use words that are not generally used. So use cases are cases that we kind of test a product on. For example, HIV is one use case where it has specific scope and context that needs to be understood in order to implement. So when we're saying HIV as a use case is one angle where we can utilize AI. So it's not a different concept except for context and understanding of what that ecosystem is, basically.
Right. Thank you, Howie. That's perfect. And Namonde, maybe we switch to you. You are actively using AI and you're building it into your programs. You're utilizing it for the benefit. What would you see as the greatest risk, greatest benefit, of course, and greatest risk in the HIV response?
Thank you, Charlene, and good day to everybody else. I think that the greatest risk, honestly, well, let me start with the benefits. The greatest benefit is its ability to process large information quickly, which then I think is going to help with healthcare workers being overburdened within the healthcare institutions. But one that I experienced recently and it changed my life was task sharing. So I went to the clinic the other day to collect my treatment, and usually admin takes more or less 5 to 10 minutes, and then vitals, checking and screening for vitals, all that situation, usually takes also 5 minutes, but waiting in the queue to go to that one room and have your vitals done within 5 minutes takes a long time. I mean, usually 3 hours at max. Only to find out that your consultation is 5 minutes long as well, or 10 minutes or 15 minutes. But when I went there, there was this really cool machine called Abby. And instead of getting into the room and spending 5 minutes there, I just went to that machine and it did all my vitals and sent me all my results via email. And I sat down, I think I waited for exactly 10 minutes, and then I was called into the next room to do my consultation, which took 5 minutes. And overall, I spent, I think, more or less 25 to 30 minutes at the clinic, which was a record breaker for me because I always spend at least 5 hours at the clinic. So I think that the greatest benefit has to do with how good it is at processing large information quickly and task sharing within the healthcare ecosystem. I think the greatest risk is going to lie in over relying on artificial intelligence, just like we're already doing in our daily lives. When you're posting a caption and you don't remove AI punctuation or you put all the unnecessary emojis with it, I think that's the greatest risk where AI moves swiftly ahead alone without people, because then there's a great chance of it misinterpreting daily life because AI is just, technology. It doesn't have all these lived experiences. So it can give us a template, and our lived experiences, our insights, the community, and everything is supposed to be working hand to hand with AI. So I think what we strive to do as humans is just put all the work in AI and let it do everything. But unfortunately, it will not succeed without our input throughout the whole journey. Thank you.
Mm-hmm. Thank you, Nomonde. I love that response. And I'm wondering if I've ever copied something from ChatGPT with funny emoticons that I should have probably removed. It's too late now. But thank you for that. Makes total sense. Rohit, you are coming, ethics and governance is your bread and butter. So you're seeing this from a very different lens, and you're experiencing it differently. Would you like to share your thoughts?
Yeah, so first of all, thank you very much for inviting me to join today. It's really a pleasure. I guess I would say the risks and benefits sort of are two sides of the same coin. So I think there's a lot of um, promising applications or uses of artificial intelligence. I think certainly when you're looking in HIV, but also in other areas, I think a lot of people especially look at diagnostics and diagnosis in particular, and to some extent for surveillance and for understanding how a disease is evolving in a certain place. But I think, all the promise of those uses are sort of tied to the same risks, which is that we are already in a period of overestimating or sort of overhyping the ability of artificial intelligence to solve a lot of problems that are much deeper than a technology. And at a time at which the risks that are involved with building and using these technologies are often not visible either to the people who are making them or to the people who use them. And also at a time in which there's other factors that are sort of pushing us to make use of these technologies more aggressively. And this is in large part because the technologies themselves, you can go from an idea to an actual use or deploying it in as little as 12 months and I think that's a lot faster than when we consider other technologies. And this is also occurring at a time in which basically there's very little regulation of the technology, either because it doesn't qualify for regulation, because a country may not really have the resources in place to regulate it, or simply because a company or a developer doesn't really bother to submit it for oversight. And that means, therefore, that the people who end up wanting to use these technologies may not really be able to know all of the risks that are present. And the other push factor, I would say, is, we're at a time, obviously, in which the resources for HIV are being cut dramatically, and the human resources and sort of our ability to provide the same level of care. And that's going to push much more the use of artificial intelligence as sort of an equivalent for the things that we should be relying upon building much more human resources and capacity. And that's going to sort of push us then into taking more risks and potentially more shortcuts.
Right. Thank you so much for that, Rohit. And Solange, you're speaking from an academia perspective on this as part of the commission. And as you were writing out your chapter, I'm sure you've also kind of thought about what the risks and benefits are. Can you very briefly give us some of your thoughts?
Hi. Yes, I don't want to repeat those that have already been said. So I'm just trying to think. I think the most obvious risk was the one around, reinforcing inequities that already exist. But I think about eroding sort of a governance, AI risking sort of eroding a governance model that made the HIV response effective in the first place, which is through communities. So in other words, like program priorities now being set almost like on predictive models rather than community realities. That kind of drift, I think, is very easy to happen, and it's a risk that we have to see with our eyes wide open and make sure that we actively design to counter that drift. Even if it's funding decisions that could be made, that you can follow this algorithm and you have a risk score rather than a lived experience. And sort of going to what all the other speakers have said, who is eligible for service could be the way you would target determined by that algorithm or a system that has been built on a particular platform rather than what communities are themselves interrogating. So in other words, AI sort of replacing communities instead of being a tool placed in the hands of communities. I think that's something we have to seriously guard against. I was thinking about when Namonde was talking about going to the doctor in person, I think about it from a personal level in terms of benefit. I certainly have used it before I get to the doctor. So I have silly questions in my own head because I need to understand when is the best time to take a particular medicine, or if my stomach wasn't right that day, is this medicine better than that medicine? But I don't really want to be sleepy. Like I have 600 little questions in my head and I don't want to disturb the doctor or go wait in line to see a doctor. I just ask. And so I would get my sort of, I don't know, personalized triage in my own autonomous kind of way. I think that is one of the greatest benefits because before I would have to look it up and make some analysis, call a friend who might have a doctor or nursing background, or actually then take time out of work and go to the doctor. So I think that in addition to the faster processing of large data, I think that on a personal level, there's that. But there's the shortening of that feedback loop, what communities experience and how the health system responds. That to me is the greatest thing. So if we can find a way to harness that and put that back into actions. Thanks.
Thank you so much. That's very valuable. And I guess you're speaking about the efficiency part of it. And Tatiana, you work on how the AI treats you. It's a different topic. So do you have any brief comments for benefits and risks? Yeah.
Hi, everyone. Thanks, Charlene, for having me. For me, one of the greatest benefits will have to be accessibility, because many people are hesitant to ask questions about HIV or sexual health because of stigma or fear of judgment or lack of access to healthcare providers. So AI-powered chatbots can provide confidential 24/7 information about testing, prevention, and treatment. And this can especially be valuable to young people who are in communities where they're scared to open up about their sexual health. And in this way, AI has the potential to reduce barriers to information and empower people to be more informed about the decisions they make about their health. But with that said, the greatest risk will have to be, like how we said, creating this bias based on the data that the AI was trained on. In the context of HIV, where stigma is already, it already discourages people to speak or seek treatment. So even subtle judgment in the response can discourage someone from speaking. So the chatbot needs to be trained efficiently to avoid stigma so that those people can still feel safe to chat about their problems. Thank you.
Thank you, Tatiana. And I guess, Dr. Hudson, you have to take all of these risks and benefits into consideration, right? Coming from a government perspective, but also managing sort of health systems at that level. What would you say are the top benefit and challenges or risks?
Good afternoon, everybody. I think they have talked a lot about data, how if we want to process large volume data like we want, or every time data is becoming really large volume, it can do that. But I just wanted to just go on the area of trying to reduce the personal feelings and the, between like humans. I think it is very, very important that uh, I don't know whether the machines, as they we develop them, they can also have empathy or those kind of things, which are not, which are used a lot in health and between individuals. I think this is one of the things that probably AI may not have now, but the disadvantages which they have talked about are really many. The advantages, I think, are the ones that make the people who develop AI sort of improve it every time. We have definitely issues like here in Africa. Definitely, the infrastructure is not good yet. The digital literacy is still low. Although when I was talking to some patients the other time, they told me, "Oh no, we know now, like what Solange was saying, we can just do AI and know which medicine, which side effects." But I think it is possible that it may be the algorithm may have been wrong, and you actually make a lot of mistakes. So people relying on AI is increasingly coming out, but I think it may be a problem. So we still need the humans to come in. We have regulations that have been available for data and recently for the digital approaches. But those regulations have not actually brought in AI because AI is still evolving. So you can bring it in some level, then the developer goes beyond that. So the regulations we are still thinking they have tried, but they have not reached because the AI has not reached, has is still evolving. So they can just do a small part of it, but they cannot do everything. So they a lot of data risk, and we don't have the safety of data. With the accountability is still a problem. So we need to make sure that we have regulations and that make sure that uh, uh, the human is protected. And
Thank you. Thank you.
yes, yeah.
Great, thank you, Dr. Hudson, and really you've done so well to touch on some of the other topics we were going to cover. Following this was really around the perspectives from panelists on AI governance and community leadership. Tying in that community leadership aspect, and you've done really well to speak from government around some of the regulatory mechanisms that exist or do not exist that should be planned to ensure the oversight, the transparency, and the accountability. And also, the mechanisms that regulators require to guarantee community-informed consent and transparent decision making. So it's quite clear from your perspective that these things still need a lot of work if we're going to talk about safety. And I don't want to leave you alone just yet, Solange, because you mentioned something quite prominent around the governance. You talked about the governance model, right? And how about you have to be careful that we're not running the risk of eroding this governance model, and that communities actively design to counter any of the drifts that could happen that changes governance models that do not serve the communities they're meant to serve. So perhaps I can ask you, I mean, we're segueing into the next topic discussion of communities, and I can ask you to share from your paper that you're writing now at the Lancet, what are some of the concrete governance mechanisms or accountability metrics or design practices do you recommend to ensure that communities are embedded as active decision makers? Because at the end of the day, we do worry that the drift means the decision making does not happen at the community level engagement, which is what we are aiming for to have an equitable health system. So, what are some of those accountability metrics or governance mechanisms you can think about?
Thanks, Charlene. I'm not so sure if I want to start with directly answering your question because I just want to bring us perhaps into a concept of this value exchange that's happening that we probably aren't fully cognizant of. I think of coffee beans and drinking coffee. I think of cocoa beans and very expensive chocolate, let's say in Geneva. Agricultural products, the pharma, and then what you buy in a high-end shop or a market grocery, and how much of that value actually goes back to the person whom gave up that raw product. And I think it's very interesting, the poll question that was half-half, saliva versus web browser history. And the idea of wanting to give up your saliva but not your web browser history has something to do with the fact that that's my data and that's my business. I mean, you won't say it out loud, but it's essentially that. And you don't need to know what everybody picked. But the point is, there's this concept of embodied data, that my data is actually very much a part of who I am. And you can't just take my data and not return something in exchange. And this has been happening from time, we can think about agri-beads if you want to go into the sort of economics of how money came to being, and the idea of extracting raw data or raw materials from a community or a group, and then taking that for in perpetuity value outside of what its intended first purpose was. And so maybe Rohit will come in with all the legal terms, but I'm actually touching on very big regulatory and legal concepts. And the idea of fair value exchange. If I'm going to give this up and you're going to use it for maybe the intended purpose for no term limits till time, and for purposes that might continue to roll on, what's going to come back to me as a community or as an individual? And so what does that fair value look like? And these kinds of concepts, you can think of it as an individual level, a community level, and a national level. So thinking about these sort of term agreements that happen before you actually set up your AI, and thinking about this specifically in HIV and for health. I mean, we're touching on things here because we have PEPFAR MOUs, we have sort of these boxes where things are happening, and not everybody has line of sight into what exactly did we sign up for when we exchanged for our money. What are we saying about the data that we get? So I'm talking about things on multiple levels, but your exact question has to do with that point of, and where's the community governance here? So yes, there are national laws and rules, but what also we need to be making sure that is part of this ecosystem is a community governance where you can say, sorry, we changed our mind. Sorry, we need to pause that. I'm sorry, this is incorrect. Let's withdraw this. Where are those governance systems? And that's your question. So I'm talking about teeth, enforceable rights, not lovely theories that communities are lovely people and they should be involved, but how can they actually have enforceable rights? Thanks.
Yeah, that's lovely, Solange. And I guess, Rohit, this might be a great way for you to come in to really respond to Solange on some of those comments and speak more about concrete community-led mechanisms that can realistically mitigate some of these harms in practice. Would you care to share some of those?
Yeah, and I mean, I try to, I guess we should think about this both, in terms of mitigating, but obviously also in terms of preventing, as I think Solange is alluding to. So I think maybe there's 5 I could bring up. So the first is just that this idea of this sort of exchange of value, I think as Solange is putting, is really important. And there's actually, I wouldn't be as familiar necessarily with data that's been collected specifically for HIV and AIDS, but if you look at indigenous groups, for example, globally, and especially New Zealand and Canada, what they've done is they built data cooperatives, and these data cooperatives therefore allowed them to do two things at once. The first is that you don't want to be excluded from the data sets that are obviously going to be used to train or to be able to make the artificial intelligence work properly. At the same time, you want to make sure you're not being exploited. So by creating these community cooperatives, they're able to set the terms and conditions, so to speak, to how their data will be used, to ensure the data is being used out there, and then essentially to be able to follow through and ensure that those who use that data are abiding by the terms and conditions they've set. A second is just around design. And it's interesting. Everyone is always talking about getting people to engage with people who are developing these technologies and making sure that they're working with them to do it the right way. I think we're not far, though, from where actually communities and people who are affected by HIV are looking to improve the response are going to be able to do more and more of the design on their own. So what we're seeing, especially right now, is the development of really, I mean, they're essentially most people, if they spend enough time with it, can now just basically write a command and ask to develop a technology. Now, obviously, it still requires all of the work that to ensure that it works safely and effectively. But I think we're very soon going to go from being very passive about design to being very active about it. A third area is something called red teaming. So essentially, red teaming is where you test something out to see whether it works well or not. And red teaming is obviously thought of as often is thought about as something that's done on a very technical basis, but it is also something in just essentially people who are going to be affected by the technology or use it basically get to trial it out and to find all of the faults and problems with it. And I think that really allows then a developer, as well as the people who are going to use the technology, to make sure that they're anticipating all the potential faults. And I'll just say a last one very quickly. It's just litigation. HIV response has been driven a lot by litigation. We'll maybe come back to some of the issues about liability. We're going to need a lot of litigation actually to be able to start setting out the boundaries and the ways in which these technologies should interface with communities.
Wow, that's a lot. And it's really insightful, a lot to think about, and a lot of technical jargon. But thank you so much, Rohit. I do want to take some questions. I'm not sure if there are any questions already popped into the Q&A section, but if you have a question, please pop it into the Q&A and we can bring it up to the panel for some discussion, yeah? Okay, so while we're waiting for the questions.
I saw, sorry, one comment in there I was going to type in, but just around this idea that we've already given up a lot of our personal information through social media. Absolutely correct. There are responsibilities that social media sites have that they're not following through on in terms of also first people who actually develop private groups where they have an expectation of privacy that is then being violated by social media sites. And these are often the only places in which people can convene. But there is also a distinction between the data that we provide on a social media site and the types of data that go beyond what we are sort of communicating through social media, in which we have an expectation of privacy and is data that we actually should be able to continue to control. So I just want to make sure we're distinguishing between different types of data. I think that we've gotten into this pattern of believing now we have no personal data anymore because of the way in which it's being exploited in certain places, but I don't think we've reached that point.
Right, right. Thanks, Rohit. Thank you for adding that on because that really, it opens up the conversation about exploitation of data, and that includes, the bias that comes with it. While we're waiting for some questions, I'm not sure. Aha. Here's a question for you, Rohit. Survey asks, how will AI affect research and development and access to HIV medicines?
I'll be brief just so other people are jumping in. I mean, there's been over the last decade, essentially a lot of pharmaceutical companies, that are developing new medicines have tried to sort of integrate artificial intelligence throughout research and development of new medicines and vaccines. And to some extent, it's been successful, and to some extent, it's sort of been overhyped. I think there is an inequity that is going to occur in that because most of it's being driven by the private sector, they're trying to use artificial intelligence for things that are very profitable commercially, as already pharmaceutical development is. So it is likely that there will be some instances in which it will apply for use in HIV and AIDS, but it may not necessarily reach in the same way we see now the populations that are most likely to benefit. And it may not be done on the scale that where we could see benefits simply because they're going to chase after the next cancer drug or something in which they can charge much higher prices. But definitely, we are seeing this evolution of the pharmaceutical sector because of the use of AI.
Great, thank you, Rohit, and thank you, Sergey, for that question. There is another question from the group, and I think this is a great way, Haminet, for you to kind of segue into one of your questions around bias and data quality issues. So the question is, please, can you explain a bit more of how AI broadens inequities? Yeah, so go ahead.
Yeah, thank you so much. That's a great question. So when we're talking about AI right now, we're talking about the broader usage of like AI, which is more like generative AI, that is like ChatGPT or Gemini, the technology that we're using to just interact with, right? So we've been using AI for many years for health, even in other sectors, to predict and analyze a lot of things like weather forecast and stuff like that. So, but when we're talking about generative AI, the inequalities that we were talking about, at least I was talking about earlier, is usually the models that are built to enable this generative AI to interact. They're usually using a large sets of information or data that are available like on a public platform, right? Maybe online, what are publications, what are the resources, videos, things like that that are available. And based on those, then they're able to predict what the next pattern would be, which is how do I respond to this, right? So if the data is already available, is not, and we've talked about how low and middle income countries like such as like African countries, for example, we don't have access to a lot internet or information as broadly as other countries might have. So the inequalities will be, the data that we also have available online would be limited. Hence, how if we're asking questions to, for example, if we ask like ChatGPT to generate images in the beginning, maybe would by default assume that you're a white person, and then it would build some assumed presumed predictions of what that would be like. So I mean, we're improving on that like people are getting involved in making these inequalities a little less prevalent, but we still see them in like some nuances or biases that are there when we're talking about HIV or any healthcare related topics. The stigma that is there on certain cases are already broadly available, and how people use social media to create like negative comments and things like that build to these like models being misunderstanding and maybe having more biased responses than we would need them. So the fact that these models were not inclusive of communities like ours puts us as a disadvantage because we didn't contribute to them to begin with. That's the inequality that I feel is there.
Mm-hmm. Yeah, fantastic.
Just to add something on the bias,
go
I
ahead.
think I think the algorithms sometimes which are used in the development of these AI models may not be universal. So you may find that in some areas they don't apply, yet they apply in other areas. So, and also you may find that just like you have schools where the children have access to digital applications, and they learn faster than those ones that really are on paper. So even HIV, it's the same. So yeah, that's contribute to the biases that we are talking about. Thank you.
Perfect. Thank you, Dr. Hudson, and thank you, Howie Nate. I have one more question from the group, and I'm going to throw it out into the universe and see who wants to take their pick. The question is, HIV data is highly sensitive. If you had the ability to ban one use of AI in HIV programs specifically, what would it be? Or would you not ban anything? So what is so sensitive that that AI as a tool should not be tackling at this point in HIV programs?
Generally, personal data.
Mm-hmm.
Personal data is a very, very sensitive thing. And unless you are given permission to access it, then I think you shouldn't access. So I would think really personal data is one of the things that we are very careful about when we are dealing with the digital applications. Even when we are doing data warehouses, we make sure that clearly we de-identify and all that. So just that's what I wanted to say. Maybe some other panelists can say something.
Great. Thank you, Dr. Hudson. I'm not sure whose hand came up first. I think it was Solange and then Solange. Okay, go ahead, Solange.
Yeah, but Namonde came on camera. Maybe she wanted to go and she didn't raise her hand. I will quickly say I worry about things that infer risk without consent. So you're starting to say, oh, because then we have an issue with risky people instead of risky circumstances. You see it all over PrEP. You could be in a risky situation or circumstance. You're not risky people. And so you have these biases that come in, and now you're having these things that are training to say, I'm going to infer and predict risk without someone's consent. You have to be very clear, I feel, about that. That can lead to criminalization and all sorts of other violence, arrest, other problems.
Right. Hawinette, go.
Yeah, Solange kind of said what I wanted to say, which was like, I wouldn't ban, like, I mean, maybe I'm biased as a technology person, but I would say that, we would be risk and maybe sharing private information, as Dr. Hudson mentioned, but there's also a need for it, right? Like when people are at risk, or we've seen it in use cases where, again, I use the word use case, but in circumstances where, people kind of talked about self-harm, or cases where like imminent danger was observed. So in those cases, like sharing their personal information is important and legally responsible, like a legal responsibility as well. So I would say like cautiously having clear guardrails, like, guidelines or procedures in place would ensure that technology is not used in a malice way. But I would say, fully automating any process is also quite dangerous, right? Like you want humans in the loop, people that have expertise or understanding of like what the circumstances could be or the nuances could be should be included within the processes. But I wouldn't say specific like parts of the situation where you'd say this I cannot do in the technology, because it enables us to see things that we might not have. So I would say the way that we implement this technology is where we should be more cautious of, as opposed to what we're blocking, because that we pattern of saying no to things, but there are advantages to it as well. So
Perfect. Thank you. I know you had your hand up, Rohit. Has it been covered? Yeah.
Yeah, no, I think.
Okay, great. And Namonde, I know you came off or on screen. Is there anything you'd like to add?
Yes, just shortly. Solange also covered what I wanted to say, but I think that when everything is created within a system of helping people for a certain cause, the intention on the ground is always sort of good. And then what happens when something is available and accessible by everyone in the world, then there are a lot of nitty-gritty things to sort of try to combat. So I would say, I'm not sure about the word ban, but I think an extensive look into whatever application that is. Because as I was thinking about the essence of disclosure, right? I know that it's very sensitive and very confidential, but at the same time, there needs to be an AI intervention that sort of helps the community when it comes to disclosure. But then if it goes out in the world or something somehow within the application and the privacy things, et cetera, do not go as, per implementation plan or whatever, then there's a risk that is open. But I think that there would always be contingency plans to sort of combat things that come out. But I think it would be I don't think if it's wise for us to always be looking at things in terms of what should not be done completely, because the greatest breakthroughs come from the most uncomfortable programs or interventions that were created. So I do think that needs to be more integrity and a more strict level when it comes to implementation. because we do not know how well and how extensive a certain intervention could actually contribute within the response unless actually tested. Thank you.
Thank you, Nomonde. Please go ahead, Tatiana.
Okay, so I kind of agree with Howie. I wouldn't necessarily want to ban something because I feel like every information we get is very helpful. With regards to private data, someone like me who deals with labeling, I don't see the personal information, but people usually come and they talk about very sensitive things. I had one conversation where someone was asked if I had a HIV positive test, if I found out I was HIV positive and I wanted to kill myself. So with someone like that, it's important if we have your private information so we can be able to contact you and check and make sure if you're okay. So the system would flag that as high risk and high priority, and then we can check up on you. So if we're banning personal data, then we won't be able to check up on these people who are in need.
Yeah, very valid points. Thank you so much. There is one more question, Solange. This is for you probably. So if you could just answer that in the chat box because we are moving ahead of time. The question is from Tang Duan. If communities are contributing data, lived experience, and trust to help train or improve AI systems, what would fair value exchange look like in practice? So please go ahead and respond to that. And anyone on the panel, please also contribute as you feel fit. Tatiana, I don't want to leave you just yet. You've made some valid points, and we've spoken throughout our interactions about the work you do and sort of how you're evaluating AI as a system for change, but that has empathy and has all of these attributes that make people feel safe. Because I think that was one of the issues we spoke about, right? Is that people aren't feeling safe with this tool and also what the tool is doing in terms of moving into decision making and so forth. Now, in your experience, what kind of metrics or indicators do you recommend to measure whether AI communication is non-stigmatizing, for example, and community appropriate, and it's landing in the right space, and it has all of the characteristics to serve that specific community?
Yeah, thank you, Charlene, for your question. Like I previously mentioned, I deal with stigma and tone. So in my line of work, we evaluate the chatbot's responses using a structured framework to make sure that everything people are getting is safe. I'll talk about 5 metrics that we use. The first one is we check the stigma level. So when you ask the chatbot a question, we check how stigmatizing is the chatbot's responses. For example, if I come and I text and I'm like, I went to a party yesterday and I slept with 3 people and I'm scared I might have HIV. So if the chatbot says, well, people who engage in irresponsible behavior may contact HIV, that's a bit stigmatizing and it lacks empathy. A better response would be HIV can affect everyone and testing is an important way to protect your health. So this will encourage me to go and test. But if you tell me that I'm irresponsible, then I become defensive. And the second matrix we use is to check whether the language being used is appropriate for HIV counseling or sexual health and relationship counseling. So if you go to a counselor and then the counselor keeps saying HIV victims, it's it's not a good language you'd want to use to someone who's HIV positive. You probably say something like people living with HIV. Using person first language is important because it emphasizes dignity and it also reduces stigma. The third thing we check is local relevance. Our chatbot is made for South Africa, so we want to make sure all the data is based on South Africa and we are not training our model based on global data. So if someone comes and asks, where can I test for HIV? So you want to direct them to places like Clicks or their local clinic. But if our chatbot was trained on global data, then they probably won't even know, the chatbot won't even know what is Clicks. So that's one thing we check. We also check with slang. So a lot of people who come and they'll use certain slangs. We need to make sure our chatbot knows South African slangs and they're able to respond to it. There was one scenario where a girl came and said she's a Christian and she's scared of DJing. So the chatbot did not understand what DJing meant. So we have to make sure we explain what DJing meant, because the chatbot did ask, can you clarify what is DJing? So that's why we are there to train and make sure everybody gets correct information. The fourth one will be empathy, which is very important when it comes to HIV conversations, because people often ask questions because they're worried, they're scared or uncertain. You don't want to add to their worries. You want to reduce their worries. So a purely technical response may answer the question but fail to support the person emotionally. So if I say I'm scared I have HIV, low empathy will be, well, you should get tested. Okay, yes, I should get tested, but then I'm scared, you know. So a more empathetic response would be, well, it's understandable to feel worried. Getting tested is the best way to know your status. There are many clinics around you. Would you like some recommendation? And this clinics, everything is confidential. Don't worry, your privacy is, secured. And another last thing that we test is understandability. So not everyone that comes to use the chatbot is literate in health. So you might have a 16-year-old who doesn't really know all these terms. So we need to make sure our chatbot is able to speak speak in a way that everyone can understand. So if I come and ask about HIV treatment and then the chatbot says, well, antiretroviral therapy suppresses viral replication. What's that?
Yeah.
It's a lot of jargon. So you'd want the chatbot to say, well, HIV treatment reduces the amount of virus in your body, which helps people stay healthy. So
Yeah.
that's basically the 5 matrix that we use. Thank you.
Perfect. Lovely. Thank you, Tatiana. And maybe a follow-up question, and also Namonde, if you can jump in here, is in these metrics or in these indicators that you build, where is community participation? So is there a platform or a space where the communities are actually filtering or advising or bringing in the inputs and engaging to be able to shape these metrics that you put forward?
Okay, for me specifically, we don't really have in community engagement at this level of stigma and labeling, but in our office, we all come from different backgrounds. So we all have different life experiences. So usually when we come across a conversation which we are all unsure of, we'd sit together and discuss and say, is this right? Should the AI have said this? What's better? So everybody's different input helps us, and we would have a meeting where we would give this to, let's just say, Howie, and discuss with Howie, and then Howie will take it to the engineers. And
Yeah, great. And one day, I mean, you have shared some effective examples earlier about community sort of shaping, or not shaping necessarily, but being part of some of the AI processes and gaining the benefit of it. But if we're talking about governance, that's something completely different, right? In terms of the design and the deployment and the decision making. And from that stance, there's also this concept of meaningful community participation. Like if you had to bring communities in and involve them in the governance and enable them to lead governance in this way, what does meaningful participation in AI projects look like for you?
Thank you, Charlene. Firstly, I just want to confirm that I am not a robot because I didn't see that tick, but I am not. So I think from a community perspective, honestly speaking, there hasn't been enough participation of community when it comes to partnerships and AI development of health interventions. Although I do believe that it is most critical that community is present throughout all the stages, from design, from, I think, the problem core, like what is the problem that we're designing for. I think community needs to be there to be present and attest that, oh, actually, that is a problem that I think is worth investing this much money in because it is so troubling to us and interferes with how we move on daily. So I think that partnership shouldn't just look like I guess developers and program directors coming up with a solution and then calling communities. I think from the very idea of whatever problem you're solving for, it needs to respond to the actual needs of the community. And in that way, we will not reproduce existing AI tools or AI solutions that are already existing. Communities should help define the problems that matter to them, identifying gaps online. I think things like viral load or adherence progress sort of things need to be present. But because I don't think community has been present within the AI world, that's why those things are sort of lagging behind as compared to chatbots. Because a lot of people have already started creating chatbots and they can see that they work. And so everybody is just doing chatbots. And that shows me that community is not present, because if community were equally present within this partnership, I would say, okay, let's hold on with these chatbots. Can we just really design for something that will really respond to my need? Like I know in Norway, they already have an online health record viral load progress tracking situation. And I think that's something that I would bring up if I were present. In terms of deployment, communities should guide how these AI tools are rolled out, because an intervention could exist, but people don't necessarily know anything about it because it's just in the AI world. And then it stands a chance of not being used by the people who should be using it and actually gaining help and assistance from the product. But because they don't know, they're not going to use it. And then we say something failed, but it was never really widely proposed to the general public. I think also in terms of evaluation, the community should be present to sort of assess whether AI is actually meeting these needs, responding compassionately. Is it person first centered? What happens to the individual's data? Is it still private? Like, would you bump into this person whose data you just saw? I remember we were looking at some responses from a chatbot. Responses that, so the chatbot that I'm talking about is self-serve. And I had seen a lot of chatbots in my youth. But what stood out about self-gov is how youth-friendly it is, created by young people for young people. So it's pretty much very relatable. So I used it for a couple of days and I thought this is something I would like to share with my peers out there, because sometimes they really do send me DMs at 3 a.m. and at 3 a.m. I'm sleeping, but at least there's a chatbot that is, always available to assist you. So I posted a video about the chatbot and a lot of people gained access to it. And I remember we were preparing for a presentation. So we went through some of the most interesting comments from individuals who are now like using the AI, using the chatbot after my video. And I felt very uncomfortable. I was like, okay, I don't necessarily know these people, but I'm sure they know that their data is out there, but they are trusting that nobody can see their data. But at the same time, now we're able to actually implement programs that respond to these very, weird or sensitive questions that they would not necessarily ask me or a healthcare provider. I mean, I saw one of the most disturbing comments, but even that can be solved for. So we could come in there and say, okay, because a lot of people are struggling with A, B, C, and D, what if we implement something that responds to that? So they never know, really. They'll never know that I saw who said what. However, they will always know however, they'll always respond the help that they needed, regardless of, the fact that they needed a quick response. Now it's just a program away, like it's a system that already exists. So, so communities will assess, those interventions. They will improve health outcomes and how the AI tool responds. And I think it's particularly important for, AI systems to respond to triggering words. I think I used self-love again because I wanted to trigger it and see how far it can go. And the next day I received a call from a healthcare provider and I was like, okay, cool, you care for me, but damn, it was a joke. It was truly a joke. But that just shows me that there is like a human involved within this to actually respond immediately, or maybe not immediately, but after a couple of hours, to sort of help other young people, especially as it relates to, gender-based violence. So I think meaningful participation of communities shouldn't just really be at consultation level or co-creators for the sake of the word co-creators, but the problems need to meet our actual realities. The solutions need to basically solve those problems, and we need to be involved in every stage. Thank you.
Thank you. Thank you, Nomonde. Such valuable insights, and you have proper real experiences here. This is so rich. Thank you very much. Tatiana, I know you have you want to probably respond to that? Yes, please go ahead.
Okay, when Nomondo mentioned that she said something to check how far self-carve will take it, so that's where you want to reassure people that there are people behind it, because I also do labeling for self-carve. So if you do mention something that you experienced sexual assault or there was violence done against you, we do see that and we risk it. We label it as high priority, and that's when the people come and contact you to make sure you're okay. So just wanted to emphasize on that.
Great stuff. Thank you, Tatiana. I do want to pause a little bit and bring in our two planned interventions from the floor. So I'm going to ask the first participant, who is Nicolas Reyes Galindo, and who is going to be positioning an intervention from the floor today. Nicholas is currently pursuing a master's degree in social and cultural studies, and Nicholas also works as a methodology and monitoring professional at Corporación Red Somos, a community-based organization founded in 2007 that focuses on HIV prevention, sexual and gender diversity, and community building. So please, Nicholas, thank you so much for joining us, and please do share your intervention with us.
Yeah, thanks. Can you hear me well?
Yes, hear you
Can you see me?
perfectly.
Yeah, thanks for this opportunity, and thanks to all the panelists. It's very insightful to hear others' perspectives. As it was said, Corporación Red Somos is a community and community-led organization that focuses on HIV prevention in Colombia. And over the past year, we have been co-creating an AI-powered chatbot to adapt community engagement in HIV response to the dynamics of, let's say, social media and mass communication. So it's important. It's important to note that we also offer services as psychosocial legal counseling and, of course, HIV rapid testing to the communities. And therefore, we have been complementing the work of our staff. We have recently implemented a chatbot allowing us to provide basic guidance on key HIV information and combination prevention strategies, but detecting when will it be appropriate to engage with a community leader for addressing critical health issues, or book a space for professional counseling. In just 3 months of implementation, it has connected with more than 1,800 contacts and referred close to 150 people to sexual and mental health services. So as you can see, it has been a radical change for us. But that said, we have recently been reflecting precisely on the technological dependence, as some of you have said before, specifically in what the continued use of these tools might entail. For example, the search of funding extends to sustaining these strategies without necessarily having the opportunity to seek a degree of autonomy from technical support providers or the companies that manage generative AI models. Therefore, we believe this is an opportunity to consider how economic barriers and ideological biases affect community services by increasing the power of private actors of accessibility, complementary or community-led health services, the usage of sensitive and intimate information, and of course, the influence in public health policies. So that's basically our experiences so far. Hopefully, we will advance in this kind of conversations around this legal programmatic framework of using AI in Colombia and Latin America, and hopefully, we will have some more insights for this global issue that we are reflecting on. So thank you so much for having me.
Thank you so much, Nicola, for sharing that information and also seeing how much of headway you make in the organization with regards to AI and HIV and sort of the health response, right? Because at the end of the day, it's all integrated. We also have another panelist member from the floor who is going to be giving an intervention. Tang Don is the Executive Director of Lighthouse Social Enterprise based in Vietnam. And Lighthouse is a community-led organization working to improve health and well-being outcomes for LGBTIQ plus communities and other young key populations, with a particular focus on HIV/AIDS, SRHR, so sexual and reproductive health rights, mental health, and integrated community-based service delivery. So please go ahead, Tang. The floor is yours.
Thank you very much, Charlene, and hi everyone. I'm sorry that I'm not able to open my camera right now, but very happy to join with you. Very enjoy the conversation. So I'm bringing here the perspective of community-led organization working in HIV literacy, service delivery, and rights advocacy for young key population in Vietnam. Our experience with AI is still very early and very practical, but it has already shown us something very important, is that technology should not replace community leadership and it should strengthen it. At Lighter, we have been using digital tools to support access to HIV, HRH related services. For example, like Rainbow Health Hub website, supported by Elgin Donate Foundation and love2test.vn in partnership with Gilead. It serves as the digital entry points where user can access information through AI-powered chatbots, also explore national-wide the service map, and also connect to support in a more private and less intimidating way. For many people who are facing stigma, fear, and uncertainties, the first step is not walking into a clinic. It is often searching online in a space where feel safer, feel belong to, and also more within their control. We also work with Grindr for Equalities and ITPC Global to support in-app online outreach and campaigns and links user to different HIV services via Grindr apps. One particular apps for gay men community globally, but it's very popular in Vietnam. This helps us to reach people where they already are, rather than expecting them to enter to the system that may feel unfamiliar or unwelcoming or judgmental. So one point I want to emphasize is that our approach to AI and digital tools must be participatory and community-centered from the beginning. Before developing a product, we engage and collect community feedback to understand people's pain points, the needs and also expectations and concern. We are also involved community members as active contributor in shaping ideas and features of the apps or the products, so they are not just end user, but part of the design, the process itself. And during piloting and implementation, community user continue to provide real-time feedback and also allowing us to adjust and also improve the products as needed. As we know, the community have the evo needs, and it's not only like one needs at a time. So from our experience, the values of AI and HIV is massive, but it's not only about efficiency, it is about reducing barriers, expanding choice, and making services more responsive. But there are also the real concern about privacy, about biases and governance, and who get to make the decisions. Communities should not be treated only as the data source or data or target user, but they must be involved in shaping how these tools are designed and governed and evaluated. So I really hope that this can contribute a little bit in the conversations and very much looking forward to learn from all of you. Thank you so much.
Thank you so much, Tang. And likewise, I mean, you've had so many experiences now where there's definitely pieces from the project and the interventions that we can draw from as we continue to talk about these governance models of AI and HIV. Thank you again. We are almost at time. I told you, and I was right, that we were very ambitious with this discussion, and we had a jam-packed session. And we, of course, we didn't get to all of the discussion points and so forth. But I do hope this was insightful, and I'm pretty sure we're going to be having much more discussions. This has really just sparked the conversation, and we will be snowballing this into larger discussions that turn into the sort of governance models we want to see in the world. But I do want to leave the session with the last rapid fire round from our panel members to in 30 seconds, not 3 seconds, that's too little, 30 seconds. If you could give your key point that you want to put forward as a take-home message for this discussion or from this discussion, what would it be in 30 seconds? Great. So I'm going to start off with Dr. Hudson. Please go ahead. 30 seconds. What key point do you want to put forward as a take-home message for us today?
So for us, our first aim is to protect our people and their safety and their privacy. And that's one important thing that we have to do. And AI, we can't stop it because it is showing some usefulness in a lot of areas, but we have to regulate it. So we have laws, digital laws, and other things that we have to work on to make sure that we protect the data of the individuals, but we also have we are cognizant of the cost of things, because if the community enjoys something and it has to be at the expense of the our physical spaces, then definitely we are really concerned. So as we learn more, we need to discuss all these. What's really the cost that AI brings to HIV? It is already expensive. So what does it bring to it? Does it really save anything, or does it? So we need to make sure that that's known. Thank you very much.
Thank you very much, Dr. Hudson. Tatienne, what would you say are your key points for take home?
For me, is AI has the potential to expand access to HIV information for people who might otherwise feel too afraid or stigmatized to ask questions, but technology alone cannot eliminate stigma. So to make AI truly helpful in HIV responses, we need human oversight, we need community perspectives, and a continuous evaluation to ensure that the system communicates with empathy, accuracy, and respect. Thank you.
Thank you, Tatienne. Rohit, please go ahead.
Just that, I think very much the rules of the road are still undefined. They're still being written. And I think that really requires, therefore, to not be passive about how that moves forward. When I think about the way in which systems and laws and policies and technologies work for specific communities as it relates to diseases, it's always required very active involvement and very actively shaping those technologies. If you just rely upon the way a large company is going to develop the technology, or a government is generally going to write the rules of the road, it's not going to really fit the realities that I think this community is going to have to think through in the coming years.
Right. Perfect. Thank you, Rohit. Please go ahead, Howie Nate.
Thank you. 30 seconds is way too small. But for me, when using these technologies, I think we discussed it a lot more. Trust is around like the data and the technology is really evident, like important. And we achieve that trust and, confidence of users by being transparent, making sure that people are aware of what they're talking to. It's not a human, it's a machine, but it could be faulty sometimes. It might be bias sometimes. So just making sure that people understand that this is what they're getting and giving them the freedom to also give feedback and get that feedback loop like quicker back is very important. Another thing I wanted to mention though is like these technology initiatives, especially when we're focusing on community facing like products like the AI companions or even different tools, these won't provide impact immediately. It's like a long process and it would take time to make sure that like that is like a large scale impactful project. So patience and resource allocation for these works is highly important. And the understanding that if one technology fails, disregarding all of like the good that it could do is is not a fair assessment sometimes. So making sure that we give the patients and understanding that technology impact takes time is also important.
Perfect. Thank you so much, Harinate. Nomonde, please add in your piece.
I think my piece would be with the HIV response being a blueprint for the HIV response. We have already seen that programs are most successful when communities lead, and the same principle should apply in artificial intelligence. Thank you, Charlene.
Thank you so much, Nomonde. And Solange, please drive us home.
I mean, what's left to say, guys? You said it all. I mean, the only thing I could just add on perhaps is just that if you reflect on the HIV response, as Nomonde is saying, technology has always succeeded. Oh, sorry. Technology has always succeeded when followed by community leadership. So if you think about ARVs, generic access, community-based testing, PrEP, even community-led monitoring, all of that has to be led by communities. And it's sort of Nomonde's point before, which is it can't be solutions looking for a problem. You have to start at the pain point of the affected community. And in this case, people living with HIV, what are they saying that they are struggling with? And that's when you build something to meet that need. So AI is no different. Just keeping communities at the center of how the tools are designed, governed, and used, then we can see that AI will strengthen the response and we'll be less worried every corner about mitigating concerns and risk, because we know communities are actually baked into the response, including AI as a tool. That's my thought. Thanks.
Fantastic. Thank you very much, Solange. And thank you to everybody that has attended the session today. I really, the closing reflections from this panel, I'm going to assume them as my own closing remarks too, because it's just so fantastically said, and we're out of time. Otherwise, we'll be here for many more hours. But again, thank you to the panelists for attending and sharing your contributions and your insights. This has really been a rich discussion. And of course, it's just the start, right? Like we've been having conversations in isolation. We're having this webinar now. We need more conversation to happen. And and also from the participation of the attendees. Thank you so much for being part of this process and listening in, weighing in your excellent comments and some jokes on the chat box I've seen briefly. Some people are robots and some are not. We really appreciate it. Yeah, just to say thank you for that. Just a quick reminder again for the upcoming AI 101 training for community leaders and also the Global Community AI Survey, which will be rolled in the next few weeks. So please do look out on our social medias for that link. And then I am popping up the email address if you do want to reach out to ITPC on anything regarding the webinar and the discussion topics. If you have any really cool insights you want to share, you want to drop us some more comments and questions or anything like that, please do share. It's admin@itpcglobal.org. You can reach out to us at that mail. With that being said, let's close this webinar. Thank you very much, and we will see each other in other interactions.
Thank you very much.
Bye.
Bye, guys.
Thank you.
Thank you so
Very
much.
much.